Hi, welcome to Mental Health Myths and Facts. I'm Dani Higgins. I am a licensed practicing counselor in the Denver, Colorado area, and I'm going to be presenting on basically some myths and facts of mental health, and also the meat of it is actually going to be more on like finding a therapist and what to expect from those initial therapy sessions as well. And we'll kind of sprinkle the myths and facts throughout, and then also have you guys all come up with some exercises, participate in some exercises as well. Just some thought exercises, don't worry. I won't make you get up and move around. So a brief overview of what we're going to be covering. We're going to be defining mental health and mental illness. We're going to explore our beliefs around mental health and mental illness. Explore some common mental health facts and myths, explore some of our beliefs around therapy, and some common therapeutic myths and corresponding facts, and finding a therapist, the first therapy session, and then a few questions. So just a brief introduction to what's next. And we're just going to hold a lot of the questions to the end, because going back and forth between the screens is something I'm not super adept at yet. So we'll just hold that till then. So defining mental health and illness. Mental health involves effective functioning in daily activities, which result in productive activities, so work, school, caregiving, healthy relationships, the ability to adapt to change and cope with adversity. And mental illness is kind of any impairment in that, right? So any difficulty in functioning, any difficulty with your productive activities, anything that creates challenges in your healthy relationships, so makes it hard to have healthy relationships. Things that impact your ability to adapt to change and to cope with adversity. So it's collectively to all diagnosable mental disorders, and it's health conditions involving significant changes in thinking, emotion, or behavior, distress or problems functioning in social, work, or family activities. And that's the definition given by the American Psychiatry Association. So a lot of people think like, oh, you look through the DSM, the Diagnostic Statistic Manual, the Manual of Mental Illness, essentially, that therapists use. And they see, like, doesn't everyone have some of these or a whole bunch of these? And the joke is that, undergraduate psychology students diagnose themselves with half a DSM when they take their abnormal psych class. But the difference is it impairing your ability to function? Is it causing you significant distress? Is it making it significantly difficult to work or go to school or maintain your social life and have healthy relationships? Those are really the key factors to make something actually a illness rather than just a quirk or an area where maybe you have a little bit of difference from someone else. So beliefs about mental health. A lot of people have a lot of different ones. We're going to be talking about myths and facts, so we're going to want to explore some of the beliefs that you might have. And so what comes to mind when you think mental health? And I'll just get that for now from the people in the room if anyone feels like sharing.
Mental illness feels like something's wrong with you.
Something's wrong with you, yeah.
If you could make sure to repeat what people say, just in the way.
Okay, thank you. So mental illness feels like something's wrong with you, yeah.
Stereotypes of broken and crazy.
So stereotypes about being broken or being crazy, feeling of that. Again, that's something wrong, but in a even stigmatized sense. Yeah. What about mental health? Is there any ideas that come up about healthfulness or being mentally healthy? What would that look like?
Coping with stress.
Coping with stress, yeah, definitely. Kind of your resilience, your ability to handle the changes that life throws at you. So I'd say write. You can just think in your head if you don't have anything to write with, or jot it down on a phone, but just consider a list of adjectives, traits, or other words when you imagine someone with mental health challenges. Like the things that immediately come to mind. Some of this is going to be things that you've heard society say, or that you've heard your family say, or that you've heard from other people. Some of these are things maybe you actually believe. And maybe some of them are good things or bad things or challenging things or whatever else. Just kind of consider, you don't have to share this with me at all. It's just an illustration for yourself. I'll give you a few moments to do that. Okay. So, one myth is that people with mental health issues just need to get over it. This is a really common one, the idea that you should just pull yourself up by your bootstraps. You should just be able to deal with it if you're having struggles or challenges, that maybe it's just that you have a weakness of character, or you just need to buck up or get stronger. And that's a really common perspective in a lot of society. Obviously, it's a myth. Obviously, I'm biased as a mental health counselor. But really, mental health issues come from a huge variety of factors. So a lot of times you might hear about neurochemistry, and everyone's kind of seen the Zoloft commercial with the little bouncing ball that is sad and talks about how it doesn't have enough serotonin. So there's the factor of the chemicals in your brain that are imbalanced, not going from one part of the brain to the other correctly. Maybe there's too much of it, whichever else that is. Biology, neurochemistry, past traumas, insufficient or ineffective coping strategies, the environment you're in. So being in a highly stressful environment can exacerbate or even create mental health challenges. And trying to just get over it, well, one thing, a lot of people don't just go to therapy as their first go-to. A lot of times they spent years trying to do something different, or trying to deal with it on their own, or finding ways that they don't have to admit they have challenges to deal with, or that they're not different from anyone else. And so a lot of people just try to get over it because they've internalized all these messages. It involves denying that you're having struggles. It involves suppressing the issues you do have. It involves a lot of shame because, well, I should just be able to get over it, so why am I still dealing with this? And anytime you hear that should word or should not, that's usually shame coming in and judging and saying, well, you should do this, you shouldn't do that. But obviously that's not what reality is and not where you're at. So that just makes it worse, and you just feel crappier. And 75 to 80% of people who get professional help for mental health challenges show benefit. So obviously getting help does something. So why do you need to do it on your own if there's the ability to get help that will actually be effective? Another myth, mental illness makes people unpredictable and possibly dangerous. So this is kind of a big narrative right now, right, with all the shootings that are going on in the US. People are like, oh, well, we have a mental health problem, we have a mental illness problem. When honestly, people with mental health conditions are statistically more likely to be victims of violence than perpetrators of violence. So there was a study that I did include in here somewhere. Hang on one moment. Yeah, so a study, a violence risk assessment study with a sample size of 1,136 people found that the prevalence of violence among those with a major mental disorder who did not abuse substances was indistinguishable from their non-substance abusing neighborhood controls who did not have a major mental disorder. So if you did not have substance abuse issues, but you had a major mental disorder, then your rate of violence was equal to the people in a similar environment who also were not abusing substances. Substance abuse doubles the rate on both ends for both people with diagnosed with major mental disorders, and people who have not been. But the main risk factors for violence are being young, male, single, or of lower socioeconomic status, not mental illness. And then mental health problems don't affect me or people I know. This is in large part because mental health is not something that is often talked about. It's getting talked about more as time goes on, but there's still a lot of stigma around it, and it's still something a lot of people keep pretty private. But someone in your life probably does have a mental illness of some kind. And in a 2014 study, about 1 in 5 American adults experienced a mental health issue. 1 in 10 young people experienced a period of major depression. 1 in 25 Americans lived with a serious mental illness like schizophrenia, bipolar disorder, or major depression. And suicide is the 10th leading cause of death in the United States. So it's relatively common, it's reasonably serious. It's something that not talking about is not helpful for. Before I move on, is there any myths that people have heard of around mental health or mental illness? Any things that come to mind that maybe you don't believe, but you've heard from people around you that I haven't covered? All right. And I am sorry for the people remote. I will cover the ones you brought up if you did at the end. So another bit of a thought exercise is some of your beliefs around therapy. Can anyone tell me what psychotherapy is? Do you have a definition at all, or any idea? Yeah?
Talking through mental-related things with another person?
Yeah, talking through mental-related things with another person, for sure. It's definitely an aspect. Anyone else? All right. And who goes to therapy, or what sort of person needs therapy? You don't have to necessarily share this one, but you can just think about that, what comes to mind immediately.
Everyone?
I mean, that would be my answer, but again, I'm biased.
That's also an answer.
Okay, great. He said everyone, by the way. And then think of a list of words, descriptors, or adjectives, or traits that come to mind when you think about therapy and the people who might go to therapy. Again, we'll just have a moment of reflecting on that rather than writing it down. Okay. So this is kind of an official definition of psychotherapy, specifically of counseling. There are a bunch of different counseling and psychotherapy and psychology organizations out there. The big ones are the American Psychology Association, which is, if you've ever had to write an APA style, then that's where that comes from. There's the American Psychiatry Association for psychiatrists who prescribe medication. There's the American Counseling Association, which is the association I'm a member of. And there are a number of others. Basically, for every subset of counseling or modality, there's probably an association. But this one comes from the American Counseling Association. They had a lengthy 31 counseling organizations came together or sent their delegates and came up with a unified definition of counseling across these different organizations. So counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. Counselors work with clients on strategies to overcome obstacles and personal challenges that they are facing. So it's a wide variety of things. Like, it might not just be you're having some mental health challenges, or you're struggling with depression, or you're dealing with a crisis in your family. It might be you're working on your education or career goals and you're kind of struggling around there. Maybe there's some motivation challenges, or you want to learn how to have more effective relationships, and you're working with that. So it's a huge variety of things that can be covered in counseling. But yes?
I've seen a definition kind of similar to describe a career like a life coach. How would you like compare and contrast those two?
That is a good question, yes. So life coach and counselors are very closely related. And we have to be very careful from a legal standpoint to differentiate the two. Counselors can cover the role of coaches easily enough. Coaches cannot cover the role of counselors, or else they're operating outside their area. A coach is more like a mentor, kind of an accountability partner. They are there to help you do goal formation. Usually it's maybe career related, sometimes a little bit of shape of your life related, but not dealing with heavy emotional stuff, not looking into your family of origin. It's a lot more problem solving and kind of advice and exploration of your goals oriented, specifically, which is still a subset of counseling, but is the subset that coaches are allowed to work within. Coaches are not currently regulated as a profession. They do have certifying organizations, but do not have to be certified in order to advertise as life coach. And a lot of counselors do retire to become life coaches. That has been a thing. They just have to be very careful to not operate as in the counseling domain, and it's a very fuzzy line. My understanding is that there's movement towards regulating life coaching, so that might be a little more clear in the future, but right now it's a pretty fuzzy situation. Thanks. So, myths about therapy. Therapy is only for people going through a crisis. What is your name?
Sam.
As Sam suggested, anyone can benefit from therapy. I say almost because I hate to use any blanket terms that incorporate the entirety of the population, but almost everyone can benefit from therapy. And it's easier to develop crisis skills and stress management skills when you're in a better place. When you're in the midst of crisis and huge amounts of stress, it's actually really hard to learn how to cope with the stress because you're in survival mode. You don't have a lot of mental and emotional or physical resources to learn new things and develop new ways of being that are different from how you've coped with things for your whole life. That's actually very hard. And so going when you're doing a little better can actually be very beneficial to prepare you and give you better resilience to cope with the stresses of life. So at a previous agency I worked at called Noeticus Counseling Center down in Denver, they divided clients into level 1, level 2, level 3 as part of our charting, administrative stuff, and as part of coordinating care for clients. And level 1, it means that you are in crisis. You are having an extreme difficulty maintaining your work and school and relationships. This is you're having a lot of impairment in your ability to function. And so level 1 is, a lot of people go to therapy at level 1 because that's when you're kind of desperate. Level 2 is kind of the mid-tier. You're having some challenges, you're having some trouble in your work and school and relationships. You're getting by, you're kind of able to keep your head above water. It's hard, and you could use some extra help, and you'd like it to not be so hard. And maybe you dip in and out of level 1 when you're a level 2. And then level 3 is you're doing really well, but you'd like to be happier. You'd like to be more fulfilled. Maybe you are considering, what do I actually want to do with my life? Maybe I'm considering a career change, or I'm looking for self-actualization. I'm clarifying my values. I'm exploring my spirituality. I'm just wanting to go in for checkups like you would like a physical doctor. And so maybe I'm doing really great, but I'm going to come in and check in every month or every other month to just go over things and have some time to reflect on how my life is going. So level 3 is the kind of the everyone else category, who people don't typically necessarily think of as needing therapy. So another myth is that therapists will give advice, solve problems, and will fix me. Actually, I ran into this the other day of someone said, well, therapists just give advice. It's like, actually, I joked that the first entire year of my graduate program was learning to not give advice and to stop solving problems for people. Because it's about helping you figure things out for yourself and providing some tools and providing some structure and providing some education, but not telling you what to do. That disempowers you. That is not actually as helpful as helping you figure it out and giving you the tools to figure it out for yourself. So therapists are more like guides on a backpacking trip instead of drivers on a lift. You have to do the walking yourself. They've been there before maybe, but they're not going to be able to walk the steps of the backpacking trip for you or carry your backpack for you because they've got their own to carry, right? A car mechanic on the phone when your car is broken down in a remote location. You can't quite get it to the mechanic, and maybe no one can even get out to you, but you can manage to reach someone so they can walk you through getting your car up and running and well enough. And over time, maybe you learn how to just fix it yourself. And therapists are people who hold up a mirror so you can better see and understand what you're going through. It can be really hard to understand your own problem when it's just you inside your head. Sometimes having a bit of perspective or having someone reflect back to you what they see is going on and what they hear you saying, and connecting the dots of what you've described in your past and what you're describing now, it can highlight that reflection and bring some clarity to your situation and help you figure out what to do next or where to go next. Therapists are just paid friends. Why can't I just talk to my friend? I can get the same benefit, right? I mean, if you have a therapist friend, maybe, but hopefully not. Hopefully your therapist friend has better boundaries than that. So therapists are highly trained facilitators of the growth and change process. It's an undergraduate 4-year program, a master's program of usually 3 years, sometimes a doctorate on top of that. Plus, you can't get licensed until you've had 2 years of supervised clinical experience after grad school. There's a lot of training. And then you have to keep going through trainings to keep your license up. So things that a therapist provides that a friend might not. Some distance from your situation, physical and emotional. Distance from your life and social circles. If you're talking to a friend about something that's going on, especially if you're having a conflict with another friend or a conflict with your partner or challenges there, your friend might take sides. Your friend might get emotionally invested. Your friend might feel defensive or concerned in a way that isn't helpful to you. Or is helpful, but in a different way than a therapist can provide. There's more, maybe you feel like you have to protect your friend or take care of your friend's feelings, any feelings they might have in response to what you're sharing with them. You have to worry about how they know someone or what their relationship is to all the people in your life. A therapist provides confidentiality and neutrality. So again, that neutral point where you don't have to worry about them necessarily taking sides, or they're going to be having your back pretty unilaterally because they don't know these other people. And confidentiality, maybe you do trust your friend to keep your stuff confidential, but do you necessarily, your friend isn't under a legal and ethical mandate to keep everything you share with them completely inviolate and secret. A therapist has a strong mandate around confidentiality, which we'll get to in more detail later. But that plus the distance means you can pretty well trust that it's not getting back to your other friends. Skillful reflective listening, psychoeducation, coping skills, and resources. So back to that amount of training therapists go through. Reflective listening is a skill. Listening without judgment is a skill. Not projecting their own stuff onto you is definitely a skill. Being able to educate you about some of the things you're going through, put names to some of them, provide models that have been well studied or formed, so that you can go, oh, okay, this does make sense. Like, I do see how this fits into my life or the path that I might take to get through it. And coping strategies. Some skillful friends might have coping strategies for you, and that's great too. But therapists most definitely do. Coping strategies being different skills, methods, and life changes you can do to make it easier to cope with life and difficulties. And resources. They might probably have community resources and are able to connect you up to different areas of your city or your town that will provide professional assistance, housing assistance in some cases, doctors, whatever kind of fully rounded area that you need. So if you get to this point and you decide, I would like to find a therapist, or maybe you had a therapist and then you've kind of stepped away from a therapist for a while and then you're like, okay, I'd like to go back, or you're really not happy with your current therapist, all of which are possibilities. Or maybe you have a child or a teenager who you feel would benefit from seeing a therapist. Or you want to go see a therapist for couples counseling or relationship counseling. Finding a therapist can be a really challenging step. First of all, coming to the idea that you need a therapist is a big challenge. And then how do you even find one? So the first go-to is if you have insurance, your insurance company has a list of providers on their website. Sometimes they have an employee assistance program, which I believe Google has. And that is one route you can go through. And that will bring up a list of therapists. It can be a little hard to navigate. Maybe you call the insurance company, or maybe you go to their website, or maybe you log in. But that's one starting place. One note is that the insurance company's list of providers is sometimes a little out of date, weirdly enough. I find actually that Psychology Today's therapist directory, because each therapist maintains their own profile, is usually more up to date as to what insurance the therapist takes than necessarily the insurance company, because it can sometimes take a little bit to update. I've run into that a couple times. So my go-to is Psychology Today's therapist directory. And if you do just like a Google search or something, oftentimes that is just what it'll lead you to, is some Psychology Today profiles. You can also ask a friend or get a referral from your primary care physician, your doctor, anything like that. And when you're going and doing your search for a therapist, trying to figure out what kind of help you need is also a big part of it, because there's a lot of different options. So do you need individual mental health counseling? So it's just you and your head and what's going on for you, and so you just want to see someone one-on-one. You're probably going to look up a licensed professional counselor, an LPC. You might look up a psychologist, a PsyD, but they tend to be a little more specialized on assessment. If you're looking for relationship or family counseling, you look up an LMFT, a licensed marriage and family therapist. If you're looking for medication, sometimes you can just go to your doctor. If you're just starting out and you're just looking for, say, medication for your depression, your doctor might just be able to prescribe you some stuff starting out. If it gets more complicated or the things your doctor's prescribing you just aren't working out, then you want to see the specialist who is your psychiatrist or a psychiatric nurse practitioner. Social services, if you need help with housing, work assistance, disability assistance, a disability advocate, anything in the social services realm, then an LCSW, a licensed clinical social worker, is who you go to. Addictions counseling, you're dealing with drug or alcohol addiction. Talk to a LAC, a licensed addictions counselor, or a CAC2 or a CAC3, which is a certified addictions counselor level 2 or 3. A CAC1, not so much. That's more someone who doesn't have as much training and maybe runs groups or helps out or volunteers. And treatment centers are also great for certain levels of addictions issues. A support group. that's usually good in addition to therapy, but sometimes it can really help to talk to people who are going through similar things and kind of work through stuff together. That can be, if you're having difficulty getting any progress in your individual therapy and you've been to a bunch of different therapists, maybe try a support group. Learning disability, like if you're dealing with learning disability or anything like that, specialists, often psychologists, sometimes social workers, but someone who lists that as a specialty. There are a whole bunch of different types of psychologists, like educational psychologists, and so on and so forth. So some of them have specialties in learning disabilities. And if you're looking for assessment, you're looking to get a diagnosis, go to a psychologist or a psychiatrist, occasionally a social worker, but psychologists are your go-to for assessments. So that's what all those strange letters, there'll be more, but starting out. So speaking of psychiatrists, one myth is that people with mental health issues just need to find the right medication. And that's not entirely wrong. Medication can help a lot, but it's not a complete cure. We've done study after study after study. The studies, of course, have been focused mostly on antidepressants, so I can't speak entirely to bipolar, schizophrenia, and the like, which are also very helpful with medication. But for antidepressant medication, combining psychotherapy and antidepressants is clinically significantly more effective than medication alone. And they found that applies to major depression, panic disorders, so panic attacks, and obsessive compulsive disorder, OCD. Another one, going the opposite direction, is that psychotropics, psych meds, turn people into zombies and kill their creativity. So when it's accurately prescribed and appropriately taken, it can help people be more fully themselves, increase their quality of life, and have the capacity for greater creative expression. But finding the right medication and the right dosage is challenging. If you're on the wrong medication, it can turn you into a zombie. That's not a good side effect. If that's the side effect you're getting, you talk to your doctor and say, hey, this is not working for me. We need to change something. If it is killing your creativity, then yeah, talk to your doctor and say, hey, this is not working for me. This is not a tolerable side effect for me. A lot of people, though, like if you're really depressed, you might have creativity, but you don't have the energy to do anything with it or the motivation. If you have ADHD, you don't have the focus to channel your creativity anywhere half the time, or the ability to manage your time enough to be able to give yourself the resources for it. Once you're appropriately treated, sometimes it could actually expand your ability to use that creativity and do something with it. So this is definitely a very personal decision, but I like to quell the fear that it's going to automatically turn you into a zombie and change your whole personality and kill your creativity, because if it's the right med, is just not accurate. But the journey to get there can be changing a bunch of medications, and that can be stressful and challenging and create some changes in the meantime. So, risk-benefit analysis there. So Psychology Today. If you go to psychologytoday.com, then you'll get this screen. Obviously not today, that was from yesterday, I think. And you have this Find a Therapist window down here. And the Find a Therapist window lets you plug in your location. And there's also a drop-down menu there that allows you to look up support groups or psychiatrists and treatment centers. So you can also look up those by your location too. So I searched for Boulder, Colorado, since that's where we're at right now, and it brings up your list, right? It can be a huge list, and that's a lot to sort through. And those letters we talked about, LMFT, so that's your licensed marriage and family therapist, LPC, a CAC3. We talked a little bit about those. Those are showing up there, but also more letters, clusters of letters that we didn't cover. It gets confusing. In this case, EMDR is eye movement desensitization. I don't remember the full acronym, but it's a body-based therapy that's used frequently for post-traumatic stress disorder. DBT is dialectical behavior therapy, which is an offshoot of cognitive behavior therapy that's very focused on, that basically combines cognitive behavior therapy which is very thought and behavior changes, with mindfulness, which is being in the present moment and being aware of what you're doing in each moment. But if you see on the right side of the screen, yes, the right side of the screen, you have your various filters, which helps you narrow things down very quickly. And so that's where we're going to start. So first, you select your insurance, or not. Maybe you don't actually want to select insurance. There's a whole lot of reasons you might not. There are a lot of very qualified therapists who don't take insurance, because getting on insurance panels is a chore and a half, and a huge amount of paperwork. And then billing for insurance is also an additional large amount of paperwork. And then getting reimbursed by insurance is a lot of difficulty. And so a lot of therapists, especially people who are in their private practice and it's just them and they don't have any assistants, will choose not to take insurance. Some therapists also don't take it because they have ethical qualms with, because a lot of insurance, in order to cover, requires you diagnose. And some therapists do not like diagnosing. And have to have the right diagnosis for the insurance to be willing to cover it for longer than 4 to 6 sessions. So a lot of reasons you might not want it. You might not want to have a diagnosis, in which case you would probably need to pay out of pocket. So in addition to that, there's issues, which are the things you're going to therapy for. More on those in a little bit. Those top 2 are probably the most important ones to select for. The rest of it is a little more based on what your needs are. So sexuality is if you need a therapist who's competent with gay, lesbian, bisexual, or otherwise queer clients. The only options listed are gay, lesbian, and bisexual. But selecting one of those. There's gender. So some people prefer a female therapist. Some people prefer a male therapist. So you can sort it by gender so that it only shows you male or female therapists. Language, if you need your therapist to speak a language other than English, there's a whole list. Faith, sometimes therapists advertise their religion or the religion they specialize in working with. There's a whole list there too. Types of therapy, this takes a little more knowledge about what you're looking for and what kind of therapy is out there. But if you have a preference, maybe someone's recommended that you go get Emdr for your trauma, or maybe you would prefer to get cognitive behavior therapy. But there's also stuff out there like art therapy and dance movement therapy, and maybe that's more your style. It sounds more appealing to you. But there's also online therapy. Some therapists offer video counseling. Generally, video counseling is somewhat less effective than in person because there's less information for the therapist to go on, but there can be reasons that you might go for video counseling only. So there's a whole bunch of reasons for counseling, as we were talking about earlier, and the list of issues that on the Psychology Today website is pretty comprehensive. I mean, it doesn't have everything, but it has quite a lot. So maybe you're having a chronic relapse issue, or anger management, learning disabilities, pregnancy, prenatal or postpartum depression, needing some help with medication management, or grief, or infidelity, or suicidal ideation, depression, impulsivity, career counseling. There's a whole bunch of things that you might be going to therapy for. And then selecting a therapist. So you've got this huge list, and now what? Again, that whole list of letters. We've gone over a number of those. The only one I think I haven't defined in there is NCC, which is a national certified counselor. And that means that they have passed the NCE, which is the National Counseling Exam, which they had to do if they're in Colorado to get their licensed practicing counselor anyway. So a lot of LPCs will also be NCCs. Registered psychotherapists, LPCCs, and LSWs, LSWSs. So a registered psychotherapist is a Colorado-only thing. A couple other states have something similar or comparative, but if you're a registered psychotherapist, it means you are not licensed. It does not necessarily mean that you have a master's degree or a supervisor or much training at all. In the state of Colorado, you can take, all it means is that you've taken the jurisprudence exam, so you've passed a very legalese exam on the legality around counseling, and your ethical requirements. And you've gotten the Department of Regulatory Agencies to sign off and give you a license number. So a registered psychotherapist might not necessarily be unqualified. A lot of times interns, so people who haven't graduated grad school yet and are interning somewhere and are under a supervisor, might be registered psychotherapists as kind of a CYA on the legal end. LPCCs are people who have their master's degree in counseling, and have passed their exam, their national counseling exam, but have not done the full 2 years of supervised and gotten the full 2,000 hours of supervised clinical experience to get their full licensure. So they're postgraduate pre-licensure, and they're usually under supervision. And for the people looking remote who are not in Colorado, these letters and stuff varies by state. So for instance, in Ohio, it's an LPC is the pre-licensure version, and the LLPC is the fully licensed version, just to be confusing. But in Colorado, it's LPC is post-licensure, LPCC is pre-licensure. LSW is a pre-licensed postgraduate social worker. LCSW is a post-licensure social worker. Confusing enough? So things to keep in mind when you're looking through a therapist profile is, do you like what they say on their profile or website? Does it appeal to you? Does their tone appeal to you? Do they seem fluffier than you'd like or more intellectual than you'd like? Do they meet your needs? Do they work with the issues that you're looking for? Do they work within your budget or insurance? Do they work for your location? The number of people I've had message me and ask me if I can work with their child when I list that I only work with adults is pretty high. So check those things before you message a potential therapist so you're not wasting your time. So here's an example of a therapist profile. I'm using mine because that's easy. So as you can see, we've got my name, picture, credentials, summary, a link to my website, my office address, a number to reach me at, a way to email me. Under that specialties section on the left side, therapists are allowed to list up to 3 specialties, and that's basically their top 3 issues that they specialize in working with, or prefer to work with, or have the most experience working with. And then issues continues on. I just wasn't able to fit them all on the screenshot of the slide. So that's the first half. You also see that up in the upper left-hand corner, it says verified by Psychology Today. That means they've checked your license number to see that you are actually licensed. And then the second half shows some of my qualifications, years in practice. A note on that, sometimes you might there's advantages to a therapist with less experience, and there's advantages to a therapist with a lot of experience. Therapists with a lot of experience obviously have more years under their belt. They have worked with more people and more different kinds of people. Therapists who have fewer years of practice often have more up-to-date, more recent information, or a little more flexible. So there's little advantages either way. If you have a lot of alternative lifestyle or minority identities that are not as well-defined or well-known in older generations, then seeing a younger therapist can be a good go-to. If you are concerned that you might be too much for a therapist or that they might be overwhelmed by you or not know how to handle you, go to a more experienced therapist. It's not a bad idea. So this also has that I work with adults, I work with LGBT clients, it shows the modality, I work with individuals, I don't do couples and family at this time, so if you were looking for couples counseling, you'd go somewhere else. It also has what I charge and what payment methods I take, any insurance plans I take, which is currently none. I hope to change that, but like I said, a lot of paperwork. Yes?
Is there any unique way to interpret the average cost per session?
So the average cost per session, how to interpret it.
Like, I guess the question is, how loaded is that number?
How what?
How loaded, like how much information is really in there, or is it just like kind of a case-by-case random basis?
So assume that the highest part of the average cost, so in this case, the 80 to 120, the 120 would be the therapist's standard cost. 80 would be how low they will sometimes flux or flex based on your ability to pay. And their reasons for that, or the reason or their criteria for that would be variable per therapist. So you'd have to ask in the consultation. And then types of therapy is something that you don't even necessarily need to worry about too much right away, because unless you know a lot about what different types of therapy are like or what kind works for you or you think might work for you. Because what's most important is actually the relationship between you and the therapist, which we'll get to in a little bit in more detail. So the first step is you email or leave a voicemail with your name, phone number, email address, and briefly what you're looking for help with. And I say leave a voicemail because most therapists are probably not going to pick up the phone. It's pretty standard practice for them to just let calls go to voicemail, because you don't want to be available 24/7 immediately to all your clients. That can lead to some unhealthy dependencies, or you as a therapist not taking care of yourself and burning out. So it's pretty standard procedure. So if you are calling a bunch of therapists and no one's picking up the phone, that's probably why. But they should contact you within the next 24 hours by the next business day. And then most therapists offer a free consultation, either on the phone or in person. And this is a chance to interview your potential therapist. You're essentially looking for it's a relationship. It's a professional relationship, but the relationship aspect of it is the most important part. How well you click. That's hard to find and hard to figure out who you click with, right? You don't click with every potential friend you meet or every potential partner. So this can be some trial and error. And you also want to know, are they actually going to be a good fit for you? Some therapists offer a free initial session, but I haven't actually seen that in years. So I don't know if people actually do that anymore.
They do.
Okay, yeah.
At least I know one.
Okay, so we have someone who's experienced that or knows someone who's done that. So things you might ask are like, what's your experience with the issue I'm coming to see you for? What's your experience with my demographic? It's like, maybe I'm a trans person. What's your experience with that? So you might also ask, how would you work with someone like me? Or work with someone in my situation? Get a little bit of a feel for what their approach might be. Have you been in therapy, or do you get consultation and supervision? This maybe feels a little challenging to ask a therapist, and I understand if you don't, but I really recommend it, because it's a really bad sign if your therapist has not had therapy themselves. They need to be able to have that awareness of themselves in order to provide therapy to other people. And anything else you might be concerned or curious about? So certain therapeutic approaches are more effective than others. Efficacy of different treatment approaches is hard to study, and it's highly debatable. The best we can figure is that some treatment approaches are better for certain disorders than others, but even then, it's a very minor minor significance in efficacy from the studies we've done. What we do know across so many different studies at this point, the link I have down there is to a meta-analysis of all of those, is that the quality of the therapeutic relationship is the primary predictor of change. And mind you, quality of the relationship doesn't mean that you never have difficulties or that you never have conflict or that it's just really easy and stress-free. Because actually we found that if there's been a rupture, like a conflict, and then a successful repair of that conflict, that means that has led to a more healthy, more change-inducing, high-quality relationship than if there is no conflict ever, or if there's a conflict that wasn't resolved. So the most important thing here is when you're interviewing your therapist, your potential therapist, do you feel like you could maybe grow to trust them? Do you feel like there's someone you could talk to? So do you feel like this is someone you could click with or have a relationship with, a therapeutic professional talking about some of your deep feelings with? Another one is if I talk about something illegal or some past abuse that I've experienced, my therapist will talk to the police or hospitalize me. A little tricky. Legally and ethically, we're bound by HIPAA, which is the Health Information Portability and Privacy Act, and confidentiality restrictions. But there are some confidentiality exceptions, things that therapists are mandated or required to report. If you're an immediate threat to yourself, so if you are going to kill yourself, you have a plan, you have the means, you're gonna do it after you leave. Like, they're gonna have to call the police on you. But if you just say, I'm thinking about killing myself, that's not immediately you're gonna be hospitalized. That's going to be, the therapist is going to be, okay, we're gonna do a suicide risk assessment now. And they'll go over some questions and try to build a safety plan. They don't wanna call the police on you, trust me. That's not a good feeling for anyone. So if there's any possible way we can be safe, get you to be safe without that, that'd be great. Or if you can go to the hospital of your own volition, much better. Danger to others. If you are going, I'm going to go shoot this person, and I'm gonna do it after I leave here with this gun that I have in my car. Like, they're gonna call the police on you. Again, this is going to be a talk it through and try to evaluate if you're an immediate threat. Or a danger to space others might be in. I'm going to go blow up a building. We're gonna have to call the police on you again. If there's child abuse or neglect happening right now, like if you were abused as a child and it's not likely that your abuser is abusing children or has access to children now, then that's not a mandatory report. If you know a child is being abused right now and you have given the therapist the address or location or names, then they have to report that. And ideally they'll walk you through reporting it yourself, or you two can report it together. But they're required to report if there's child abuse or neglect and they have any knowledge of, enough knowledge for identification. Same with at-risk elder abuse or neglect. There's also, so if your spouse or your doctor called the therapist and asked anything about you, they have to say, I can neither confirm nor deny that that person is seeing therapy here. Unless you have filled out a release of information form for that person, which specifies what they can share. Court orders will sometimes also be a confidentiality exception if there's a sufficient court order for the therapist to release their notes. I'm gonna speed through this as fast as I can because I'm running short on time here. So your first session, you get orientation. They'll tell you, like, did you get here okay? Here's where the bathroom is. Here's who I am. There's probably intake paperwork that you might have filled out before the session that develops the therapist policies and procedures and probably lets you give a history. And then there's the getting to know you phase, which is 1 to 3 sessions sometimes, where they get your history, do any assessments. So like on a scale of 1 to 5, rate this thing for the past 2 weeks, sort of thing. And figuring out your goals for therapy together. What do you want out of therapy? There's an idea that therapy takes years or takes 4 to 6 sessions, which is what before the Affordable Care Act was insurance would cover 4 to 6 sessions, and that was usually about it, with flex based on need. But the length of therapy varies per person and their needs. For about 50% of clients, it takes 15 to 20 sessions to be like pretty much better. And a lot of people like to go another 20 to 30 sessions over 6 months to really feel like symptoms are fully in remission and we've got a handle on it and it's stabilized. And 12 to 18 month duration or longer for some co-occurring conditions or chronic problems. I specialize in trauma and PTSD, so a lot of my clients I see for 6 months to a year, and sometimes a little longer. Is my usual with clients, but shorter is definitely possible. And how do you get the most out of therapy? Honesty versus dishonesty. Therapists aren't actually mind readers. They don't actually teach us that in grad school. So if you're not honest, then they have to take you at face value a lot of times. Like, it's not fun for anyone, and it's not productive for me to try to figure out when you're telling the truth, when you're not. It works much better if I'm just believing you. And so I tell people straight up, like, I'm just going to believe you. It's no great feat to deceive me, because I'm just going to choose to believe what you say, what you share with me. And I will call you out if there's inconsistencies, because maybe there's some self-deception going on, but I'm going to believe what you say to me and believe that you're going to be honest, because there's no point in this otherwise. Openness versus closeness. Actually sharing stuff rather than holding stuff back or hiding stuff. Obviously, this takes time. You want to build trust first with your therapist, and this can be hard to learn how to do, so that takes time too, but efforts towards being open rather than just being silent or holding stuff way back will get you to get more out of therapy. And willingness versus willfulness, being willing to try stuff out, even if it's really silly sounding or feels awkward, that your therapist suggests, versus going, no, that won't work, no, that won't work, no, I'm not gonna try that, shooting down everything. You're not gonna get a lot out of it if you don't actually try. Okay, we are very close to time, but I will try to take a couple questions. Ooh, electroconvulsive therapy. The effectiveness of electroconvulsive therapy in Myths and Facts. I do not feel I'm entirely qualified to talk about that one. I know that, because that's not something I personally have studied in great depth. There's been, it was definitely used to be a more common thing that is considered to be not as effective in the way it was used. But then there's been developments I know that some people still use it in a much different approach than it used to be used that might be more therapeutic, but I am really not sure. I'm going on very fuzzy memory here. This is not my area. Advice for talking to loved ones who could possibly benefit from therapy, but believe something along the lines of, I've been to therapy in the past and it hasn't helped, so what's the point? So going back to that willingness and openness about therapy. Therapy doesn't work if you're not honest, open, and willing. If you're feeling coerced to go to therapy or pressured to go to therapy, and you're not engaged or willing or motivated for yourself, you're not going to get as much out of it. It's going to be a lot harder. You're going to spend months getting to the feeling motivated and buy-in stage before you actually do the work of therapy. And that can be part of the process, but it's a lot of money to spend on something you're just not really willing to do or invested in or prepared for at this point. So, I have worked with someone for a year who was very ambivalent, very not entirely motivated. And it was exhausting for both of us, I'm pretty sure. It just felt like we were going around in circles. And there were times where I was like, really? Are you sure you want to be here? If you're not getting benefit out of this, you should not be paying me money and I should not be taking your money. I'm like, no. So after about a year, they finally, they left for a month or two, and then they came back, and I'm like, okay, so you have to buckle down and work, or this just needs to end, because I cannot ethically continue to see you if you're not getting benefit. They're like, no, I'm really ready this time. I had these experiences over the time I was out, and I really want to work. And then they suddenly, over the course of 3 months, made huge progress. Went from a level 1 to level 2.5. And so when someone's at that point of readiness, then they can get a lot of benefit. If they're just trying to be convinced by everyone else, and they're not willing or ready, they're not going to get a lot of benefit, and there isn't going to be much of a point. And getting them there, sometimes you just have to be patient and talk from your own experiences. Maybe therapy has helped you a lot, and you can share how it helped you without telling them what they should be doing. Speaking from your experience can be one of the more powerful ways of swaying someone or influencing someone rather than telling them what they should be doing. Again, that should word is more shaming. Well, thank you. Appreciate it.